Hello, lovely people. It's another wonderful day, and I'm privileged to welcome you all back to the Nursing Student Channel, your favorite YouTube channel that deals with all nursing knowledge and information. If you are new, don't forget to hit the subscribe button and also hit that notification bell so that you get every new video that comes on the channel. As you all know, last time in our last video, we started with a new topic, that is the nursing care plan, and we couldn't complete it. Yes, it's a very broad topic, but then we ended at the purposes of the nursing care plan, and today we are picking up from where we ended. So we are going on to, like I said, the components of the nursing care plan. The components basically talks about what entails the nursing care plan, what goes into the nursing care plan, what the nursing care plan is made of, or what we want to see or we have in the nursing care plan. And the components of the nursing care plan has to deal with, we have our time, our date and time, we have the nursing diagnosis, we have objective outcome, criteria, we have evaluation, we have implementation, and all that. But then, based on the format that we are using, some of these informations may be taken out or may be adjusted to be combined with another information. So when it comes to the formats, we basically have from 3 format care plans to 4 format care plans to 5 and then 6. The formats basically is its arrangement. Okay, so if the columns are 3, then it's a 3 format care plan. If the columns are 4, it's a 4 column care plan or 4 format care plan. And that is how it is with the other formats also. So without wasting much time on the formats, which for our purpose is none of our business, or we don't have to waste much time on, we're going to go with the components. And the components for the nursing care plan depends on the country that you are in, and then it also depends on the institution that you are in. So what we use in Ghana here in our nursing trainings, most of our nursing trainings, is usually the 6 format care plan, where we have our date and time, we have our nursing diagnosis, we have objective outcome criteria, we have implementation, we have evaluation, and then interventions. Okay, so that is what we use here in Ghana. We're going to take our time and then take the various components one after the other and talk about it, so that at least it gives us some understanding on what we are expecting to do or when we are giving the care plan. The care plan that we use in most of our nursing training institutions have 3 basic sections. Okay, there are 3 basic sections. The first part or the first section, we have the patient's information or the assessment column, where we have our patient information, patient's problems, his strength, his allergies, his daily routine activity, and then the likes. And then the middle section, that's the second section, the middle part is where we have our care plan. That is where we are going to focus on. And then the last section, that is where we have medical interventions like medications that we give, other investigations like blood samples that we take, stool specimen, urine specimen, and all that. And then we also have other interventions, that's advanced interventions that we give, like blood transfusions, IV infusions. Those form part of the medical intervention column. That's the third column or the third section of the nursing care plan. But we are going to focus on the first section and then the second section. But currently, the components of the nursing care plan has to do with the middle section. All right, we are going to go to the first section when we are dealing with the writing a nursing care plan. Okay, so when we're writing the nursing care plan, we'll take our time and start from the first section. But for now, let's focus on the middle section where we have our components. The first component that we're going to talk about is dates and time. All right, that will be our first component, dates and time. Without date and time, your nursing care plan is incomplete. Okay, you can't tell us that you did something for the patient without telling us when you did it, what time you started the goal. No, how you understand? You can't show us that you did something for the patient when we don't know when you did it. All right, so our date and time is very, very important when it comes to writing the nursing care plan. And it is this date and time that you're going to use to evaluate your care. You're going to use this same date and time to set your goals, because your goals are always supposed to be time bound. Okay? Your goals are always supposed to be time bound. We'll go deeper when we get there. So you always have to include your date and then your time that you implemented your nursing care. Alright? Yes, so that is the first section, or that is the first component of the nursing care plan. Your date and your time. Very, very important. Never forget it. Now, once we are done with having our date and then our time, then we move on to the next column of the nursing care plan, and that is the nursing diagnosis. That is what we did in our first chapters of our lessons, okay? The nursing diagnosis. The nursing diagnosis, we are not going to talk much about it because the nursing diagnosis videos are there. If you have a problem with it, you can go back, refer, and then get your understanding up again. Then after the nursing diagnosis, our next column is going to have an objective outcome criteria. The objective outcome criteria, or simply the objectives or the goals or the outcome criteria or outcomes. All right, that is what we want to achieve. What we want to achieve by the care that we are giving to the patient. All right, that is basically the objective outcome criteria. Some books may have goals, some books may have outcomes, or some books may have objectives. It is the same thing, the objective outcome criteria. It is this criteria that we are basing our care on. So if at the end of the day or at the end of our time period that we've set our goal, we don't see this, then it means that our goal wasn't achieved. Okay, so that is our goal. That is what we are basing on. So for example, for let's say acute pain, for the problem of acute pain, we can have our nursing diagnosis being maybe acute pain, into bracket. Don't forget, into bracket, we use it to specify the location. Okay, so our acute pain, into bracket, let's say epigastric pain related to inflammation of the gastric mucosa as evidenced by abdominal guarding and facial grimacing. This is a nursing diagnosis for a patient with acute pain who is suffering from a stomach disorder, let's say peptic ulcer or gastritis or gastric ulcer or duodenal ulcer. So the nursing diagnosis is acute pain, that is into bracket epigastric pain related to inflammation of the gastric mucosa as evidenced by abdominal guarding and facial grimacing. So what we want to see at the end of our time period, that we'll get to know that the goal that we are implementing to deal with the pain or to curb the pain, that's the problem, is achieved. Our objective outcome criteria can go like this. Patients will be relieved of acute pain, into bracket epigastric pain, within 4 to 6 hours as evidenced by the A, we have patient verbalizing that pain is relieved, and B, the nurse observing that patient appears relaxed and able to sleep and rest appropriately. This is a summarization of what goes into our goals or objective outcome criteria. The outcome criteria has, as stated, 3 sections. The first section has to deal with what we want to see in the patient within a time frame. So that is our goal. That is the first section. What we want to see in the patient within a time period to let us know that the patient's problem has been dealt with. And once we see that, then there has to be something that will show as an evidence or something that will ascertain that we have actually achieved our goal. And that thing comes in 2 columns or 2 parts. The patient, him or herself, ascertaining that the goal has been achieved, and then the nurse also observing that indeed the patient's goal has been achieved. Are you getting it? So if the patient's pain should subside within 4 to 6 hours, and that is our goal, what then will show that within that 4 to 6 hours the patient's pain has subsided? What we show is 1. The patient himself or herself telling you, the nurse, or showing you, the nurse, that the pain has actually subsided. So patient may not verbalize that pain is relieved, but patient can show on a scale of, let's say, 0 to 10, a pain scale of 0 to 10, maybe from when patient came, the pain scale, he was pointing to 8 as his pain. He can show you that it has reduced to, let's say, 3 or 2. Okay, that will show you that indeed the patient's pain has subsided. And then you, the nurse, might, or is supposed to also see something or realize something that will show you that indeed the patient's pain has subsided, or the patient's problem has been dealt with, and not just the patient lying. And here we can see that pain, you cannot feel pain for a patient, and you cannot measure pain. Unlike temperature that you can just check with your thermometer and then ascertain that indeed the temperature has dropped. So with the pain and other symptoms or problems that you can't see or feel with your own eyes, you can just observe it. For example, with the pain, when a patient or somebody is in pain, their facial expression shows it. So when their facial expression relaxes, you can actually confirm that the pain has also subsided. Alright? So that is the objective outcome criteria, or the objectives, or the outcomes, or the goals. We will talk more about the goals when we get to, that is, writing a nursing care plan. But even in the nursing diagnosis, you realize that we talked about the goals, and we said that your goals must always be prioritized. So when we get to the nursing care plan, writing it, we are going to explain further for nursing care plan, not as for nursing diagnosis. And then our next column is going to have our nursing orders. The orders are what you are supposed to do for the patient. Okay, so maybe the patient came to meet me, was assessed by the doctor on duty or the physician on duty at that time, and then the physician gave orders, and then also I, the nurse, also realized that there are nursing interventions that we can give to this patient to deal with the patient's problems. So then, what do I do? Because I'm not going to be there 24/7 taking care of the patient. There will be a change of shift. So the nursing orders is what I will write, or what I will put there to show you that this and this and that is what we are expected to be doing for the patient. Okay, so they are like, just as the name implies, they are orders for the nurse. So whichever nurse comes on duty knows that these orders or these items that are listed here is what he or she is supposed to do to help the patient deal with his or her problem. Okay, and the nursing orders, let's continue with the problem that we took, that's acute pain. Nursing orders for the pain could be assessing the pain, noting its location and then intensity and all that. Okay, and then we can also monitor the patient vital sign, because pain as a fifth vital sign has the potential to affect all other vital signs. And then we can also encourage patients to use coping techniques or diversion therapy. All those are nursing orders that you can put in place to help the patient deal with his problem. In most nursing schools in Ghana, you are expected to state at least 5 or 6 of the nursing orders. At least 5 or 6 of the nursing orders. Okay? So you have your nursing orders, and these are what you are going to use to perform your practicals, because it is what you are telling us that you want to do for the patient to deal with his pain. So the orders that you put in your nursing care plan, that is the practical exams that the vigilators are going to take and then give to you to perform. Because if you tell us that your patient needs to have his vitals checked, then obviously we have to make you check his vitals. Alright, so always make sure that you take simple nursing orders that can help deal with the patient's problem. Don't go too haywire, don't go too above the rope. Just limit yourself to the basic nursing orders or nursing practicals or nursing procedures that you can perform for the patient to help him. And always bear in mind, medical orders like medication is the last thing that you can do for the patient unless his situation demands that we give an emergency medication. Other than that, always make sure that you put your basic nursing orders ahead of 7 prescribed medication. Don't always make 7 prescribed medication the first nursing order. No. Nurses our last procedure is medication. We always use nursing procedures to deal with patients' problem and only rely on medication when we have exhausted all our nursing procedures. And then after that, now we have our nursing orders. So what are we going to do next? We have to implement these orders. Okay? We have to implement them, and that is nursing intervention or implementation. It is basically you putting the orders into action. Okay? The orders have been stated. Now you have to put them into action. You have to work on them. You have to do them. That is the nursing intervention. So if we say that assess the patient's pain, blah blah blah, and you do it, then you have to let us know that you have actually done it. So if you have done it, then you're going to change the, let's say, the point 1, which says assessing patient's pain and then noting its location intensity. When you do it, that is under the nursing intervention, you come and write that patient's pain was assessed, location and intensity was all noted, and the location was here. We're saying the epigastric. So location is epigastric region, and then intensity on a scale of, let's say, 0 to 10, the patient chooses a measure of 8. Okay, so that shows that you have done your nursing or that you have implemented it. So always make sure that your nursing intervention or your implementation is concise, brief but concise, having specific values, specific points to back up your claim that you have done the task. So if we ask you to check for a patient's temperature as a nursing order, and implementation, you just write patient's temperature checked and recorded, that is wrong. That is incomplete. When you check what was the value? Don't forget that we already have a temperature, and we want to compare that temperature to the current one to show that our goal has been met or our goal wasn't met. So if you just tell us that patient temperature checked and recorded, it is incomplete. So if our first temperature was 39.4, you checked and it recorded. What did you record? You have to give us values. You have to give us figures to show that indeed the temperature was this and now it has become this. Same applies with all other problems or orders that we give. So if we say that check the patient's pain intensity, you have to give us a value. Patient's pain intensity was checked and it fell on the value of, let's say, 8, or let's say 5, or let's say 4 on a scale of 0 to 10. Then we know that indeed you have done this, and we can have a value to base on in making our claims. Alright? So when you are done with your intervention, you have to let us know when you did it. So you have to write your dates and your time again. Okay? You are done with the intervention. Show us that you did it at this time on this day. Because most of the goals, for example, our pain goal, we are expecting it to subside within 4 to 6 hours. So if the goal has subsided, let's say 3 hours, you have to show the date and time to show us that we achieved our goal even before the set time. And if the goal wasn't achieved after the 6 hours, show us that after 6 hours, you check the temperature, you check the patient's pain, and it was still high, so that we know what we're going to do about it. So once you're done with your nursing intervention, once you have implemented the goal or the order, always remember to bring your dates and your time. Alright? And then the last component that we're going to talk about is evaluation. Yes. Was our goal achieved? Was our goal met? Did we succeed or we failed? That is the basically evaluation. That is the evaluation. So if our goal was achieved, let's say the pain scale, patient's pain was subsided, let's say within that 4 to, let's say 5 hours later. When we are writing our evaluation, we are going to go with if the goal was achieved, we are going to go with goal fully met. Goal fully met. And what shows that the goal was met? Let's come back to objective outcome criteria. We have a criteria that we want to use to assess our goal. And that criteria say maybe the patient should verbalize that his pain is relieved, and the nurse must observe that the patient's facial expression is relaxed, or the patient looks relaxed in bed. So if our goal was achieved, we are going to use this same criteria to show that the goal was achieved. So if goal was fully met, what shows, then we can A, or the first section, patient verbalized that his pain has subsided, or patient verbalized that he has been relieved of his pain. Are you okay with that? And then the nurse also observed that the patient appeared relaxed and resting, or the patient's facial grimacing was joyful, cheerful, or happy. That shows that indeed you have seen and you have evidence to tell us that the patient's pain or the patient's problem has been solved. Alright, so basically that is our components for the nursing care plan used in most nursing schools in Ghana. We have our date and time, we have the nursing diagnosis, we have objective outcome criteria, or objectives, or outcomes, or goals. And then the fourth section, we have nursing orders. The fifth section, we have nursing interventions or implementations. And then the sixth section, we have evaluation. But you always have to bring your date and time right after the nursing intervention to show us when you achieved your goal or whether your goal wasn't achieved. So you always bring your date and time right after your nursing intervention before you bring your evaluation at the very end. All right? Yes. So that is basically how we have our nursing care plan in Ghana here and most of the Ghanaian nursing training institutions. Now, since we are done with the components, let's look at a sample of a nursing care plan, okay, for acute pain. The example that I used, we can look at that one and then we can move on. Alright, thanks for making time with me today too. See you in the next video. Stay safe, keep learning, and don't forget, always have a nice life. Bye bye.